before that, let's talk about something that a lot of people is facing on a daily basis. Some just manage it without treatment, but some, there's mild cases, extreme cases, sinusitis. So let's say hello to Dr. Ek Tek Siang, ENT specialist from HKL. Thank you for joining us.
Good morning.
Good morning.
Now I know we are decked up in the Diwali dresses. You are also having a very brand new suit.
Yeah, thank you.
And he bought it especially for RTM. Thank you so much.
Thank you. Thank you. Good morning, Malaysian.
Good morning.
Thank you
So let's
for
talk
having
about
us today. Yeah.
sinusitis.
Yeah. So when you're talking about sinusitis, a lot of people, they're asking what is sinus. The first question is what is sinus? Sinus is actually just like a room. In layman terms, just like a room with the opening, with the door. So in our face, there's our skull. There's a lot of pneumatization. That means there are a lot of hole on our skull, just to reduce the weight of our head.
Okay.
So inside the hole, there's a line by the mucosa.
Okay.
There's a lining of cells that they actually secrete some the mucus. Then mucus will come out from the opening in the nose, into the nose. So it's called the ostium. So whenever the air we breathe in the nose or whatever, it will actually secrete into the sinus and then it come out. So whenever what I call it, because the hole is surrounding our nose, forehead, and also our eyes. So therefore, we call it paranasal sinuses. There's a maxillary sinuses, there's a ethmoidal sinuses, there's a sphenosinuses, and there's a frontal sinuses.
The causes of sinusitis.
Okay, most common causes of sinusitis. If you look, we don't really go and what I call it classify into what causes, but basically it's an infection.
Right.
Anything obstruct the ostium, the opening of the sinus, it will cause the sinusitis. It will cause the air cannot circulate out. The mucus inside the what I call it, the sinuses, it cannot come out. So anything that obstruct the ostium, it actually causes sinusitis. The most common causes is viral. The virus, whenever you have a flu, your cold, then after 3-4 days, let's say you got what I call it, causing the obstruction of the sinuses, then that they will cause a sinusitis. Just like for example, when you have a mosquito sting you, you stay the flare up. Something, inflammation. This is what I call it. Same thing happen inside the nose. Whenever you're allergic, whenever you're infection, whenever you have a growth or tumor or other what I call diseases that causing the ciliary movement of the mucosa, that will cause the impairment of the drainage of the sinuses. They will cause a sinusitis.
Okay. What we're seeing on the screen, could you just explain, is this a normal picture that we're looking at?
Okay, look at the skin. Look at the skin. Basically, you have to look at the normal first. Actually, I bring up the normal, but they show the first one is abnormal. This is a CT scan of the sinus.
All right.
Look at the skin. You can see the nose. They see a lot the whole surrounding the nose.
Yep.
You can see a maxillary sinus. You can see ethmoidal sinus and sphenoid and the frontals. So all these, there's an opening actually drain into the nose. You can see that all this will drain out in the nose in normal person. But whenever there's an infection, there's an inflammation, there's an obstruction or impaired ciliary movement of the mucosa, the drainage should be impaired. So therefore, it's very imperative that we have to make sure that ostium is patterned and open all the time.
All the time.
Whenever there's a blockage, they will cause a sinusitis.
Is it true if I were to say there is a mild case of sinusitis and an extreme case, or
is it just
when you have sinusitis, you should get treatment? Because I know some people have sinusitis, but they live with it. They just bear with the inflammation, the itchiness, because it comes and then it goes. But for some, as you say earlier before we go on air, every sinusitis case should get treatment. So maybe you can elaborate more on that.
Okay. So a lot of people, they actually misunderstand the allergic rhinitis and the sinusitis. Allergic rhinitis is just an allergy.
Right.
It doesn't mean that you will get the sinusitis. Allergies means just as I told you just now, when your mosquito stings you, you have a swelling inside on your skin. Same thing with the nose. Whenever there's exposed to allergen, your nose starts to allergy. There's inside the nose. There's 3 soft spoon. It's called a turbinate or concha. There's a 3 inferior, middle, and the superior. So whenever this one, the what I call it, the allergen that stick to the what I call it, the mucosa of the nose, he will trigger some reaction that causing the allergy. The thing will swollen. Once it's swollen, it actually block the osteum, so it will predispose to the sinusitis. It doesn't mean that you are allergic because sinusitis. It's two different things.
Okay.
It's two different things. Allergy is just like allergy that you have a hyper reaction to the allergens. Sinusitis is the infection.
Okay.
So, but however, the allergy can cause a sinusitis.
Right.
Therefore, you must treat the allergy before you getting into the sinusitis.
Oh, I see. So how common is this problem in Malaysia? I mean, do you see a lot of cases coming in, Doctor?
Oh yeah, it's quite common, very common. Especially nowadays, there's all haze in our country. You know, the weather is unpredictable.
Yep.
You know, then it's reported it's about 3 million of population per year in Malaysia that have this kind of problem.
3 million.
3 million a year.
Wow.
It's quite a
And
lot.
can this be treated by surgery? Is that possible? I mean, what are the treatment options, for instance?
Basically, we must look into what is the causes of sinusitis.
Right.
Whether it's the allergy, whether it's an infection, whether it's a tumor or some other problems. So we must treat the underlying causes.
Okay.
When allergy, you must use the allergy treatments. When it's the infection, you must use the antibiotics.
Sorry, could you just backtrack a little bit? Symptoms. Let's let the public know. What are the symptoms they need to look out for? If a person suspects he or she has got sinus, but they don't know what to look out for, what would it be?
The most common symptom will be like you have a headache, frontal headache, or the back headache, or migraine, or the facial pain, or the surrounding your eyes very heavy. Then you start with foul smelling discharge from the nose, a lot of post-nasal drips, and then you also a nasal block, mild feverish. These is most common most common symptoms before it come into the complications.
Okay. Well, doctor, we've got a caller online.
Good.
Yes. Hello.
Good morning.
Darshini. Hi, good morning. Hello?
Hello.
Hi.
Hi.
Okay, so
Basically, I would like to ask, I've got a daughter who is actually 9 this year,
Okay.
and she's been having recurrent symptoms and allergies of sinusitis. She's on repeated amount of dosages of antibiotics and antihistamine
okay.
every other alternate week,
All right.
despite taking all reasonable precautions. So what can we do to strengthen her immunization so that she'll be able to fight off the effects of sinusitis?
Okay. Well, thanks, Darshini. Thank you so much.
Thank you so much. Have a good day.
You too. Happy Deepavali.
Thank you. Happy Diwali to you all. Bye-bye.
Thank you.
Thank you.
Doctor?
So you mentioned about the doctor is about 9 years
9 years
old.
old,
9 years
yeah.
old. We have an allergy that that it's not. I think it's not controlled with the medications. Basically, you must look at the causes of allergy. Whether you're allergic to the dust, allergic to the food, whether to the weather, allergic to some other things, you must look at the cause. So in our market now, we have there's some surgeons, some ENT is offering some immunotherapy or
Right.
this lah. But basically, what we look at what we more concerned about is how to avoid these allergens. You can do an allergy test. You can look at you can find out what's the cause of the allergy. Instead of you keep taking the medication, why don't you look back and look at is it your room is dusty? Your room is a lot of toys and a lot of blanket and all this dust. You must clean the dust, all this, you know. And is it allergy to the food? If allergy to the food, you must try to avoid it. Or some other things like any other your weather, all these outdoor activities might reduce.
What are the kind of food that's that's sort of common that triggers off maybe a sinusitis problem? Would you be able to just give us an example?
There's no very solid evidence that actually what are the kind of food category of food that will cause the allergen. But
Right.
what do I notice is actually some cocoa product like chocolate or some other so-called seafood or whatever they can cause the allergic rhinitis or asthma or anything like that. Yeah, seafood.
Seafoods are
Now, our caller mentioned that her daughter's on antibiotics, and yet even then
Antihistamine.
it doesn't help. Antihistamine and antibiotics is not helping. Is that something that maybe people ought to be going into, antihistamines? Is that too early for a 9-year-old?
It's not too early. Antihistamine nowadays actually can start early.
Right.
There's a new generation of antihistamine. But talking about antibiotics, this is a bit worried. It's like we shouldn't use antibiotics in allergic rhinitis.
Right.
We shouldn't. Until we develop the sinusitis or infection, then we only consider antibiotics. We don't want the antibiotics to be resistant in the future. So basically, you can use some other things like leukotriene, Naconase, so there's many other medication instead of using antibiotics. But antihistamine actually is the purpose of antihistamine is to reduce the secretion, reduce the antihistamine, reduce the inflammation. You shouldn't take regular. When you take when your nose is red, the secretion, the allergy, then only you can take antihistamine. You shouldn't take regularly.
Okay. Well, doctor, looks like you've got the phones buzzing. So let's get another caller. Hi, good morning.
Hello.
Good morning.
Hi, good morning.
Hi, who's online?
Good morning. Hi, my name is Christine.
Yes, Christine.
Hi, I'd just like to find out that I've been having this nose problem since I was a kid. And every morning that I get up, my nose will be so blocked. And I'll be sneezing continuously when I get out of my room. And it's been causing me to have a very bad migraine, actually.
Right.
And I'd just like to find out, is that sinuses, or is that because of having a flu?
Okay.
Or what's that? I'm not too sure, so I'd like to ask
Is it
doctor.
every morning?
It's every morning, is it?
Yes, every morning I get up, my nose will be so blocked.
Okay. And have you seen a doctor?
No, I've not seen a doctor because it's only during the morning.
Okay.
And then later in the afternoon or late evening, it goes away.
Okay. Well, thanks, Christine.
Okay, thanks.
Thanks. Have a great
Bye.
holiday.
Thanks.
This is a very common
Case.
presentation to our clinic.
All right.
Every morning they have blocked nose,
Yeah.
or towards the evening they have blocked nose. There's a secretion, there's a bit of migraine. This is very common. Actually, what I feel is, I don't know how old is she. She never mentioned. So I don't know whether she any other comorbids like asthma or allergy to anything. But basically, I think what she has is actually vasomotor rhinitis.
Okay.
There's something to do our nervous system. We call it vasomotor rhinitis. Is like the nose start to have blockage, secretion. When the weather turn cold, or whether you're using the aircon at night, is it too dry, causing the crusting and then causing allergic reaction to the nose. Basically, what she needs is something nasal decongestions, and then some antihistamine, and then I advise her to go have a look to do a visit one of the ENT in the town, and then go and look in the nose, see whether we can do something for her or not, instead of guessing here and there.
Right.
Why don't you see an ENT surgeon and get it treated first?
Okay.
To prevent any complication like nasal polyps, sinusitis, before it getting worse.
Before it gets worse.
Yes.
Okay, so there you go, Christine. You just have to go see that doctor again and get it sorted. I think doctor doesn't want to say anything at the moment because we really don't have much details, isn't it?
Yes.
All right.
Okay, maybe you can also share with us, doctor, about treatments to extreme cases to an extent, maybe even surgery. What are the options available?
Okay. Follow our principle is like we must try to use the medication. We call it maximum medical therapy.
Okay.
We don't simply do operation. We don't want anyone, we come in with sinus, we straight away put in OT and do the operation. Basically, we must use the medication. First thing, there's a steroid, nasal steroid to reduce the inflammation, to reduce the allergy. Then you can use the antihistamine to reduce the inflammation and the secretions. And you can use the nasal decongestant. And then let's say antibiotics when in the case of infection or sinusitis. So when this fail, we try to do it like for 1 or 2 weeks, the medical therapy. Give her. Make sure the patient is compliant to the medications.
Okay.
Let's say patient did not improve with the medication, then probably we will consider about the surgery for the severe cases, sinusitis and its complications.
Okay. All right. Now, doctor, before we let you go, would you like to give your Deepavali wishes to all our viewers?
Yeah, I wish all a happy Deepavali to all the Malaysians, especially to the Hindu, and then and happy holiday to everybody who live in Malaysia.
All right.
Thank you for having us today.
Thank you so much. There you go. That was Dr. Ng with us talking about sinusitis. Doctor, thank you so much for joining us.
Thank you.